Now, the President of the United States ain't walking through that door. He's not going to call to ask what I think. But if he did, I'm going to give him 5 simple steps regarding healthcare policy in the upcoming election. So I'm J.O. I'm the author of Maximize Your Medicare. Book is here. You can check out the information, maximizeyourmedicare.com. The website will be on the pages. Here's the website here. It's a book. It's the 7th edition. You can find it on Amazon. Podcast videos. You can ask me your personal private questions. Information about Medicare down here as it currently stands. The premiums, Medigap, which is a type of plan that sits on top of Medicare. Official websites. Very important not to go to other websites to get forms and stuff like that. It's here. The links are here. It's free. The website has a sign up form for a free newsletter. It comes out every week, every 2 weeks or so. In next year in 2020, this book will look like this. It's at the editor now. We're debating that now. It's going to be published by Skyhorse Publishing. That'll be out in February. If you stay tuned to this channel, you subscribe to this channel, Facebook group, which is not up here, or the newsletter, I'll be giving out free giveaways. That will be occurring pretty soon since we have it in edited form at this point. So back to this. So you may have noticed, if you are at all aware of what's going on in current events, the Democratic Party is trying to find its nominee for the presidential election in 2020. There's no dispute. Healthcare reform, health insurance reform are front and center. And that, I don't think, is going to fade anytime soon. I don't think that, I'm saying anything controversial. But anyway, if we start, I would start here with the president, which is just simply don't underestimate the importance. Okay? Don't distracting to new issues. And I'm not saying immigration isn't an issue in those particular locations, but it doesn't affect the width and the breadth of our population like healthcare does. Doesn't matter what your economic status is, doesn't know what your education level is, doesn't matter what your profession is. Healthcare touches every community, period. The cost of healthcare touches every community. And in that sense, right, it becomes the dominant domestic issue now that it is front and center. So the opponents have the momentum in the sense that they have picked up on this and are carrying the ball, and it's not going to fade from front and center. That's my point here. And the president probably does well by trying to continue to match it. Whatever his momentum is for his policy changes, et cetera, improving on our healthcare system as we have it, I wouldn't necessarily stop and point out at the successes. There have been successes. For example, very recently, employers can use have the employees choose an individual health plan, and the employer can contribute to it, and that can be tax deductible, which is a new thing. It's new as even of 3 months ago. These things get swept under the carpet. I probably wouldn't do that. You need to stay front and center. I would drop the objection to the pre-existing condition limitation, and this should say a limitation here. You've already lost, I would tell the president, right? The idea that you would strip away the Affordable Care Act to include this pre-existing condition clause, that's a loser. And not only is it a loser, but it allowed your opponents to basically frame the entire party and those persons against the Affordable Care Act in any form as baby killers. Right? I don't think that there's a more evil label you could put on people. First of all, I don't think that's true. Right? I don't think that everyone who says that they're against the Affordable Care Act is a baby killer. I just find that too extreme. But in addition to that, you're hanging your other fellow Congresspeople, the Congresspeople out to dry. You're putting them out on a plank. If you are in favor of keeping the pre-existing condition limitation, that it's just so unpopular across all of this different set of the population. It's a loser. I would drop it. I would run away from it. I wouldn't mention it anymore. I'd pretend it doesn't exist. That's our platform. It's going to be super hard to put the toothpaste back in the tube. Super hard. It doesn't matter what your politics are. And I want to make that point here is that, you know, today is about what if Donald Trump called me. A previous video was what if Bernie Sanders called me? What if Joe Biden called me? So, meaning that healthcare is so complicated that I could basically choose any starting position point and find the devil's advocate position and pretty much get us to a stalemate. That's still true. It's that divisive. It is as fragmented as our society. Third, I would use divide and conquer, which is the opposition party is in a fiercely contested contest, right? And you're going to see polling numbers and polling numbers and polling numbers as you go through the caucus, process. Divide and conquer works. It doesn't only work in politics, right? Well, it's not only presidential politics, right? It also mattered during politics when you were in junior high, right? Clicks divide and conquer. You don't need to look very far, right? This is how the Affordable Care Act survived, right? We had complaints about the Affordable Care Act, et cetera, et cetera. There was negative publicity about the cost of health insurance resulting from the Affordable Care Act. Yeah, but the opponents could not agree among themselves, to propose a viable, workable solution. Well, now that same burden now has shifted to the opposition party, and they're flailing around too. You could have a situation where the Democratic nomination process devolves to such a point where it fragments the party and they can't circle the wagons well enough to try to overturn or try to get the Democratic nominee to win the presidency. That is entirely possible. If you're the president, you sit back and wait and watch this. Fourth, I would try to make friends with these three big groups: physicians, hospitals, insurance companies. And simply because any proposal that has Medicare for all, Medicare for more, or a public option, for example, Medicare for America, lower the eligibility age for Medicare, anything that looks anything like that, right, has to come from you've got to pay for it by one of two ways. Number one, taxes, right? I don't think there's any question about that. Everyone expects higher taxes. $30 trillion for Medicare for all by think tanks is your estimate from think tanks from multiple different perspectives. This is not only a Republican conservative or a liberal perspective. The mean is somewhere in this $30 trillion, trillion with a T. And basically this is the second way is you're going to lower the compensation rate, period. Doctors get less, hospitals get less. I'm the president. I'm advising the president. I would simply tell him to deploy, well, my enemy's enemy is my friend, right? They're not going to like the payment rates. The AMA, American Medical Association, already out saying that they're not for single payer, okay? You can get those people to be on board with improvements to our existing system. The last one is specifically for the largest generation in U.S. history, the baby boomers. Right? I need to win. And the way to win and the most practical way to do so is allow the CMS, the Centers for Medicare and Medicaid Services, which is a department of Department of Health and Human Services, a subsection of that, right? And that's what governs Medicare, is to directly negotiate drug prices. Currently, that's not what happens. And yet, the VA, which the monies come from a different location for the VA, a separate funding location in the government budget, the VA is allowed to negotiate drug prices with the pharmaceuticals. Under Medicare as it currently stands, they are not allowed. Why this happens, I'm not exactly sure, but But for me, that is the most important point. And the reason is that it doesn't really matter what your health situation is. I mean, from very good to very poor. Many Americans rely or are prescribed medications, whether they be generic or specialty. This is the spot number 1A with the most controversy of where your money goes, right? This is the cost on an ongoing basis, and in certain cases, enormous, enormous. So what would I simply do? The way to get drug prices from a practical point of view to the consumer is have the federal government negotiate drug prices with pharmaceuticals. So that's it for today, pretty much. The fact of the matter is this is so complicated. I'm not going to solve everything here, right? Depending on what your particular point of view is, you can agree or disagree, and that's totally fine. Totally fine. I'm not here to change your mind necessarily. I'm just saying that what I'm trying to present here and on the other videos, which you should watch. For example, if Bernie Sanders asked me, right, what would I do? What point would I bring up to try to sell my platform if I wanted to try to get the office of the United States? Talk with you next time. Hope you like today's videos, and be sure to subscribe to this channel. I hope you got something from today's video. You can find more about Maximize Your Medicare, the 2020 edition, to be published by Skyhorse Publishing, GH2 Benefits, a firm for financial services, and the Great Humanity Healthcare Foundation by subscribing to this YouTube channel today.